So let's move on to chapter 2, drug action and handling. So we're going to be learning about how a drug passes through the body and what exactly happens when the drug is passing through our body. So here we have the learning objectives. I'm just going to skip through that. Let's look at the definition of a drug. So a drug is basically a substance or something that changes our cell function. So this is a cell, the drug somehow goes into the cell and changes the function of the cell. So the drug goes into our body and makes us feel better. The drug goes into our body or into the cell and tries to make the pain go away, for example. So basically, as soon as you swallow the drug, what happens is it gets broken down into the stomach, into the intestine, it goes through the liver, and then it goes through the bloodstream. Okay, and when it goes through the bloodstream, it goes all over our body until it gets to the area that we want it to go and maybe relieves the pain in the knee so that you're able to go running, for example. So we're going to focus on potency and efficacy, and let's look at potency first. So potency is basically the amount of drug required to produce an effect. Let's look at this example here. If I take drug A, I only need 100 milligrams of drug A for my cough to go away. So the amount of drug I need to produce an effect is 100 milligrams. Let's look at drug B. I need 200 milligrams of drug B to make my cough go away. Let's compare the two. 100 milligram is less dosage, right? There's less amount of drug in this pill. If you have a less amount, it's considered more potent. So potent means how much drug do you need to produce an effect? 100 milligrams only. Well, 100 milligrams is more potent, more stronger than maybe 200 milligrams. Look at this example here. Let's say I'm in severe pain and the doctor prescribes 10 milligram morphine. The doctor, let's hypothetically say the doctor says, you could either have 10 milligram morphine or you could have 10 milligram meperidine. Well, these are the same dosage, but 10 milligram morphine is effective. The amount of drug required for me to reduce the pain would be 10 milligram morphine. 10 milligram meperidine will not work. It will not be effective. Okay, so this will do nothing. 10 milligram of this drug won't minimize my pain in any way. Let's look at this example. 10 milligram morphine, that will work. That will take my pain away. And so will 100 milligram meperidine. So 10 milligram meperidine is not, potent enough. It's not going to do anything. But 100 milligram meperidine, well, that's good. That's it's starting to work now. So the dosage is different, right? But this drug, the 10 milligram morphine, is more potent because the less the dosage, the more potent it is. Just memorize that. The less the dosage, the more potent, the more it will work, the more it will produce an effect. So 100 milligram, less dosage, which means it's more potent. 200 milligram, more dosage compared to that, which means it's less potent. So the lower the number, the more potent it is. Efficacy. Efficacy is, well, how much do I need? What is the maximum intensity of effect that can be produced by a drug? So if you look at this one, 10 milligram morphine, and you compare it to 100 milligram meperidine, those have the same efficacy because they both will work the same. They both will give me that relief of pain. So the dosage, yes, is different, but they're both as effective. 10 milligram morphine is just as effective as 100 milligram meperidine. So let's look at these terms here. So pharmacologic effects, that basically means that, well, is the drug working? Is the drug going to work? Is the drug going to affect the cell, affect the body. And the way we know whether a drug will give us a pharmacologic effect or whether the drug will, interfere with the cell that we want it to, is it depends on whether the drug will fit the cell. It depends on whether the drug will fit the receptor. And if you look over here, drug A fits so nicely, which means it'll work. The drug will work. But if drug B were to go here, then it won't fit so nicely and the drug may not work as well as we would want it to. So we want the drug to fit, okay, to fit in the receptor. Therapeutic effect is whether it actually works. Do we feel better? When we take this drug, are we going to feel better like this lady here? If so, then the drug has a therapeutic effect. And an adverse effect is side effects. You know how when we take some drugs and our stomach may feel very queasy, we may feel nauseous, that's side effects. That's adverse effects. That's unwanted effects of a drug, what we don't want in the drug. So, as I was saying earlier, the drug needs to fit the receptor, the drug needs to fit the cell. And so if the drug is a perfect match and it fits, it's like a lock and key and the key fits into the lock perfectly, then the drug is called an agonist. And an agonist basically means it fits perfectly, and when it fits perfectly, the drug will work. The drug will make you feel better. If we have a drug and it goes into the lock or it goes into the receptor, but it doesn't have proper fit, you can see there's gaps around this area, that is called an antagonist. And that means that when this drug goes in, it's not going to do anything. We're not going to feel better. If this drug goes here, we're not going to feel better. So that's an antagonist. Then we have something called a partial agonist, where when this drug goes into the cell or when this drug goes into the receptor, we'll feel partially good. That's why a partial agonist. Some of the drug will make us feel better, but the best is agonist. We want it to be a perfect lock and key. It has to join perfectly for it to work. So agonist is perfectly locked in, the perfect fit. So the better the fit, the better the drug response, the better the drug will work. Here, the drug's not fitting at all, or barely fitting, we're not going to get any drug response. Here, it's not perfect, so we'll get like a really tiny response. Our drug might make us feel a little better, but not as well as this over here. So pharmacokinetics is basically the study of how the drug goes into our body, how it goes everywhere within the body, and then how it comes out. So the mnemonic for this is ADME, ADME, which basically means the drug gets absorbed. So the drug goes inside your body, then it gets distributed. So then it goes wherever it wants it to go. Then it gets metabolized, which means the drug gets broken down into small pieces and it goes into the liver, and the liver kind of pumps out or filters out the drug. And then it just goes everywhere until it leaves our body. So until we pee it out, for example. So when the drug goes in our body, it needs to enter the cell. And for it to enter the cell, there's many different ways it can happen. There's something called passive transfer or simple diffusion. It's kind of the same thing. What it basically means is that the drug will just slide through the cell membrane and go into the area that we want it to go. If it can just slide through, if it can just diffuse, and if it just go through easily, that is called simple diffusion or passive transfer. Sometimes we'll have drugs that won't go in just like that. Like it won't go in just like that. And when we have drugs that is stubborn and doesn't want to pass through the cell membrane, we'll need a channel. This is like a protein channel. So if you have a protein channel in your cell membrane, the protein channel is allowing the drugs to pass through, and that is called facilitated diffusion because we're using a channel to facilitate it to come down. We're using a protein channel to bring the drugs down. So that is called facilitated diffusion. Lastly, there's something called active transport. And what active transport is basically the drugs Again, they're stubborn. They don't want to go through the membrane and go to the bottom part or go to the area where it has to go, and the channels aren't working. So what they do with active transport is they have this energy molecule and they bring the energy towards it, and when that energy merges with this channel, it brings the drugs down. So we need energy to bring it down. Okay, so passive transport, just easy pass, right? The drugs easily pass through the cell membrane. Facilitated diffusion, they need a channel to bring the drug down. Active transport, we need energy to bind to the channel so that the drugs can go down. And when the drug gets distributed, when the drug kind of spreads through the body, the drug needs to go into the plasma or into the blood. It needs to go into the cell, so intracellular fluid. In our cell, we have fluid, so intra means inside, cellular refers to cell, and fluid. So the fluid inside the cell, we want some drugs to go inside the cell. We also want some drugs to be floating around in the tissues, which is called interstitial fluid. Okay, so drugs can go into the blood, drugs can go into the cell, and drugs can go into the area surrounding the cell. So let's say I take a drug. Okay, I take it, it'll go to my stomach, then it'll go to my intestines or the GI tract. Once it goes through my intestines, I'll go through the liver, and the liver acts as a filter. The liver basically recycles or basically pumps out the drug. Okay, so pumps out the drug, and the drug now becomes active. So once it's going here, it's just following, the stream, the waves, and then it gets to the liver. And usually what happens is when the liver pumps out the drug, now the drug can go into the bloodstream and start to work and start to do what it has to do, starts to make you feel better. But you can see how it goes through all of this process into the liver, and then it comes out and starts to work. This is when you take an oral drug. But let's say if I get an injection. If I get an injection of a drug and it just goes straight into my bloodstream, it doesn't have to go through any of this. It just goes straight into the bloodstream. So it bypasses this whole area. So sometimes when you take an oral drug, it takes longer for it to work because it's got to travel through so many things before it can go into the bloodstream and start to work, right? So that's a disadvantage of the oral dose or of the oral route of medicine. But if you were to just inject some drug inside you, for example, when you're in a hospital, and you get an injection, it goes straight into the bloodstream and works like that, works effectively. So the first pass metabolism, there's this first pass effect. It's just a blurb of basically what it is, which is, it has to go through the stomach, then the GI tract, then the liver, which pumps out the good stuff and then takes it to the bloodstream. And so sometimes what happens is when the drug goes into the liver, so remember the liver is like a filter and it filters out the good stuff. Usually what happens is that when the drug goes into like the stomach and then the GI tract or the small intestines and then into the liver can pump out the drug. And usually what happens is it pumps out the drug in an active state, which means when it pumps out the drug, now the drug is starting to work. Now the drug is starting to make you feel better. Or when the drug gets pumped out or filtered from the liver, now the drug will start to reduce the pain that you have. So typically what happens is you have a drug, which is called a prodrug, that's not active. And then once it goes through the liver, once it metabolizes and goes through the liver, it now becomes active. That is the most common route. When the drug is inactive, pumps in through the liver, comes out, and becomes active. However, sometimes we can have an active drug, and when it goes through the liver, it becomes inactive. And again, sometimes you can have an active drug, and when it goes through the liver, it comes out and it's also active. So this means that the drug will stay in your body for a very long time because it doesn't get inactive, right? So there are many different ways the drug can be metabolized. The most common one is that usually when you take the drug, it's not active until it goes through the liver pumps it out and makes it active. and makes it feel better, makes you feel better because the liver made it active. So finally, let's say you swallowed the drug went all over your body, got distributed, and now the drug needs to leave. Well, how does the drug leave? Typically, the drug leaves through the kidney, right? You pee it out. You could also do number 2, and it comes out with number 2. It could also come out through milk. So if you're nursing a child, breast milk could have some of the drugs that you took. So it's really important that you are very careful of what medication you take when you're nursing. Drug absorption is, so when you absorb a drug, when you take a drug and it starts to dissolve and it starts to absorb and goes into your stomach, we need to keep these factors in mind. And what this is is the drug small enough to pass through? Is the drug being passed through like a IV, or is the drug being passed through the mouth? Because if it's being passed through the IV, it's instant, right? If it's passed through the IV, we're gonna get the drug will get absorbed instantly. Whereas if it was to be passed through the mouth, for example, then it may not be as instant. And this is actually really interesting. The solubility of drug. If I take this pill versus a solution, what do you think is faster? What will kick in faster? Will this pill kick in faster and make me feel better, or will this solution kick in faster and make me feel better? The answer is the solution. If I take this, it will start to work a whole lot faster than this. Why? The reason is because if I take a capsule, remember it has to go through my stomach. The capsule has to dissolve. It has to open up. Okay. Then the powder inside the capsule has to dissolve and become a liquid, and for it to work. So this is already a liquid. As soon as I swallow it, there's nothing more that needs to happen. The capsule doesn't need to be broken down because it's not even in a capsule format. When you take a capsule or a pill, the capsule needs to be disintegrated or broken down. Then the powder that's inside needs to be dissolved into a liquid state for it to start working, right? So there's a whole other process that's it takes for this to work. Whereas this, it's a whole lot faster because you're skipping the steps of disintegrating the capsule and then dissolving the powder. You're skipping those steps. So here we're talking about half-life, and half-life is it's actually pretty self-explanatory because it's like when the drug basically falls to 1/2 of its original blood level. So if I'm taking a drug, right now I'm taking this drug and I swallow it, 100% of this drug is in my body. If someone tells you that this drug has a half-life of 4 hours, what that means is that 4 hours later, half-life means half of it is gone. 50% of the drug is gone, and now you only have 50% remaining inside your body. So drugs have half-life, and it could be 3 hours, it could be 4, it could be 5, it could be any number. But half-life basically means that if it's 4 hours, 4 hours later, 50% of the drug will be in your body. Not 100%, 50%. So usually what happens is most drugs, it takes 4 to 5 half-lives for a drug to be completely away or completely washed out from our body. So let's look at that. I take a drug, and right now 100% of the drug is in my body. Let's assume that you're told that the drug's half-life is 4 hours. So 4 hours later, 50% of the drug is in my body, right? That's what the half-life rule is. Half-life is if you're given a number like 4 hours, so 4 hours later, only 50% of the drug is in your body. If you wait another 4 hours, well, now 25% is in your body. 25% of the drug is in your body. How did I get 25%? Well, half of 50 is 25, right? 50 divided by 2 is 25. If you wait another 4 hours, 12.5% of your drug is in your body. So that's half of 25%. And if you wait another 4 hours, then half of 12.5 is 6.25. So 6.25% of your drug is in your body. So how many half-lives did it take? 1, 2, 3, 4. And if I go another 4 hours, so if I go another 4 hours, it would be 5. So in this case, it takes 5 half-lives for the drug to be completely gone. Because in 4 half-lives, I only have 6.25% of the drug. If I wait 4 more hours, I would have 0% of the drug in my body. Okay, so the drug's half-life is 4 hours. That was the example given here, but sometimes it could be 2 hours, sometimes it could be 10 hours. It can fluctuate. So there are many factors that affect the drug. So let's look at sex, for example. Women are more sensitive to drugs than men, and that's because of that could be because of their smaller size and their hormones. So we would feel the drug effect more than a man. Time of administration. If you take a drug with meals or without meals, that could affect the way the drug works in your body. If you're a smoker, that could affect the way, because maybe if you're smoking, you may not, the drug may not work as effectively, right? So there's many different factors that can affect the way the drug works in your body. 2 new terms to know: onset and duration. So onset is how long does it take for it to start working, and duration is how long would this drug work. So for example, these are date rape drugs. And let's look at this example. Keep in mind, if someone puts this drug in your drink, you could start to feel weak, you could start to feel confused, you could start to pass out as early as 5 minutes. That's the onset. That's how long it takes for the drug to start working. Duration is, well, how long will the drug be in my body? How long will it work? 30 to 60 minutes. So if you got if God forbid you have a date rape drug inside your drink and someone put it on you, they have 30 to 60 minutes to do whatever they can to take advantage of you, basically, right? God forbid this happens to you, but they have 30 to 60 minutes. That's the duration they have for them to do what they want to do. If you take another drug, for example, someone puts a drug in your drink, within 20 minutes, so this drug, for example, within 20 minutes, you're going to feel weak, you're going to feel confused, you may pass out. That's the onset. That's how much time it takes for the drug to have its effect. And they have 8 to 12 hours to do what they want. That's the duration. It's a long time, 8 to 12 hours, right? That anything could have happened to you. I pray that this never ever happens to you guys. None of you guys are raped in this way. It's a horrible thing to happen. But this is just, I put this there so that we know what onset and duration means. So this could even be for Advil. If I take Advil, let's just say I have a headache. I notice that whenever I take an Advil, within 20 minutes to half an hour, I've noticed that I'm starting to feel better. So the onset is 20 minutes, let's just say. 20 minutes, I can feel my headache getting less and less. Duration, 4 hours. That's what I've noticed, that it takes 4 hours for the headache, for me to feel headache free before the headache comes back again, for example. So when the drug enters your body, the way it enters, there are 2 ways actually. There's the enteral and the parenteral. And enteral basically means when the drug is entered into your mouth, for example, and it goes through your intestines, it goes through your GI tract. Whereas parenteral is basically when the drug kind of gets injected into you, so it bypasses that whole stomach and GI tract. It just goes straight into your bloodstream, for example. We're going to look at some examples. So oral. If you swallow a pill, It's a slower onset of action, and the reason why it's a slower onset of action is because it has to go through your stomach, then it has to go through your intestines, then it has to go through your liver, and then it starts working. So it's a huge process, right? The disadvantage of the oral route is, there are more there could be side effects like nausea and vomiting. Requires patient cooperation. If you're someone like me, I can swallow this pill, but if it's like a long, big pill, there is absolutely no way that I'll be able to swallow that. I can tell you that from now. So that's a huge disadvantage for me because I can't swallow pills. Rectal route. This is where they insert a drug from your behind. And this is usually happening if someone is vomiting, right? And they obviously can't swallow, or if they're unconscious, then they might administer a drug that way. There's the IV, intravenous injection, where they inject it right into your vein. So this is quick, right? Because you don't have to go through the stomach and the intestine, right? It goes straight into the vein, and it produces the most rapid drug response. The disadvantage to that is you can get like infection, like you can get redness, phlebitis, right? You can get some infection or inflammation rather happening. We have the intramuscular route where you get injected right into your muscle. So you bypass the skin, the subcutaneous tissue, and it goes right into your muscle. These are many different ways, right? There's a subcutaneous where it goes in the middle. Then we have the intravenous, which is like where it goes into your veins. We have the intradermal, which just goes right into the skin. And look at, this is really interesting. Look at how the nurses have to position or hold their hand in order to inject into the correct site. So there are techniques to do that. So the intradermal, this is the one we probably all had done, where it's like they inject into your skin and only the skin, and that's the TB test that we had to get done. If you've ever had an epidural and they inject into your spine, that's this one over here. And if they inject into your body cavity, so an area inside your body, usually happens in rats, that's the intraperitoneal type of administration. There's also inhalation route, which is where you could, inhale something, so like an asthma puffer, nitrous oxide, which is used in dentistry to calm you down, or GA, right, when you have general anesthesia and you're put under and you're put to sleep. And then there's topical, where you put a cream in an infected area, or a patch. It could be a nicotine patch. It could be a birth control patch, for example. Those are all considered topical. Topical means that it's just put on top, right? You're not ingesting it. It's just placed on top. And here, for fun, if you want, you can watch a video where Chandler is given a nicotine patch. All right, thank you for listening. That's all.